My name is Jocelyn Manchano Garcia. My exposition is Preterm ovarian hyperstimulation. Definition is very rarely entity characterized by vulgary, hypogastric and upper leg swelling, elevated serious estradiol. E2 and gonadotropic 11 and ovarian follicular 6. 1-3. The main pathology in the immaturity on the gonadal axis and the lags on the negative feedback on the placental storage. Continue video.
Paarung findet auch statt und das merkt man dann, das sieht so aus, als würde die Pubertät verfrüht anfangen, aber natürlich hat das nicht mit Spermienbildung zu tun. Und das Problem mit dieser ganzen Geschichte ist der Mangel an Aldosteron und Cortisol, was zu einem Morbus Addison-ähnlichen Syndrom führt. Und da muss man halt Cortisol und Aldosteron ersetzen. Das würde dann die ACTH herabsetzen, sodass dieser Ablauf dann nicht weiter stattfindet. Kryptorchizismus und Hypospadieren kommen auch relativ häufig vor bei
Syndrome is a rarely conditional in which immaturity on the gonadal axis is accepted as the cause in access limiting conditional and resolved spontaneous without treatment, and the 3 months on the fake infant presented with swelling on the genitalia. She had been born prematurely and 27 weeks on the gestational, and the eggs staging in the neonatal intensive care unit. Preexisting examination revealed swelling on the clitoris and vulva wax on the wings unremarkable. Continue video.
Ovarian hyperstimulation syndrome. Ovarian hyperstimulation syndrome, OHSS, is a problem that is sometimes seen in women who take fertility medicines that stimulate egg production. Causes. Normally, a woman produces 1 egg per month. Some women who have trouble getting pregnant may be given medicines to help them make and release eggs. If these medicines stimulate the ovaries too much, the ovaries can become very swollen. Fluid can leak into the belly and chest area. This is called ovarian hyperstimulation syndrome, OHSS. OHSS occurs only after the eggs are released from the ovary, ovulation. You may be more likely to get OHSS if your doctor gives you a shot of human chorionic gonadotropin, HCG. You get more than 1 dose of HCG after ovulation. You become pregnant during this cycle. OHSS rarely occurs in women who only take fertility drugs by mouth.
Continue. Symptoms are into 3 categories: mild, moderate, and severe. Mild symptoms including abdominal bloating, nausea, and extreme weight gain. Moderate symptoms including excessive grinding gait, increasing abdominal hurt, vomiting, darker urine, and legs among excessive tears, and skin and or and eye fail drink. Several symptoms are fullness, bloating above the waist, shortness on the breath, pleural effusion, urination, significantly darker on the hands, seaxes, claws, and cheek pains, marked abdominal bloating or distension, and the lower abdominal pains. Continue video.
Ovarian hyperstimulation syndrome essentially comes from a situation where too many eggs are produced, and there is essentially a swelling of the ovaries, a swelling of the abdomen that's caused by a secretion of protein into the abdomen. And it's a situation that can exist when the ovaries of someone with an underlying problem, such as polycystic ovaries, takes stimulants, and usually it only happens when someone is conceiving, trying to get pregnant. With the process of ovum cryopreservation, as soon as the eggs are aspirated, we usually will give them something, give the patient something to diminish the chances of hyperstimulation by suppressing the.
Continue. Conclusion. A pathognomonic syndrome of the Preterm ovarian hyperstimulation syndrome is will win the book around 37 3 years old, and the syndrome is of infrequently diagnosed when the X-wing is foreign. The director antigo factor is not E2 estradiol. Preterm ovarian hyperstimulation syndrome does not require therapy as long as there is no danger of sex torsion.
Ovarian hyperstimulation is a condition that occurs when the ovary is stimulated, usually by injectable follicle-stimulating hormone. It happens most commonly in young women with a very large egg reserve. And they typically, with IVF, will get 20 or maybe 30 eggs retrieved. After the retrieval, those follicles reactivate, continue to make estrogen, and when those follicles refill with fluid, that fluid begins to leak over the surface. And it's mediated by a protein that we know about. And again, the women who get this syndrome are genetically predisposed. Unfortunately, we don't know how to identify those women specifically, other than those women that have a lot of egg reserve. And classically, it's the polycystic ovarian disease woman that has 30 resting follicles is much more likely to have this condition.
We finish exposition.